Well, we're here with Dr. Pakman from Pennsylvania, in the city of Hatboro, in fact. Dr. Pakman, how are you this new year here?
I'm great, Helmut. How are you?
Good. Dr. Pakman, you are a dentist and you do see children in your practice, even though you obviously see adults and do implants and all that type of stuff. But you also do see children, am I right?
Yes, we do.
Good. Well, tell me, what do you think? What advice do you have for a mom who's having a new baby? When should she bring the child to the dentist? What should we pay attention to? Things like that.
Well, a couple of little things that we should always think about. Children should be seen at their general dentist between the ages of 2 and 4. By this time, some dentition has already developed, and the child is starting to develop what we call their occlusion in their teeth. And it's always a good idea to be checked between that age, between 2 and 4. If the child cannot be seen by a general dentist, it should be seen by a children's dentist, which are called pedodontists, and they're very, very good. One of the things that we'd like to tell new mothers is that the baby should never be put into the crib with milk or juice. If you want to put the baby in bed with a bottle, it should be just pure distilled water. Because we find that if the milk lays on the teeth as well as different fruit juices, it can cause some problems even with the young dentition.
Well, makes sense. I mean, after all, we're adults, so even from young on, we are trained to brush our teeth after we eat and all that stuff. Right. So why would you want to soak your teeth in pure sugar, I guess?
Right, exactly. But a lot of times for convenience, the parent wants to get the child to stop crying. They'll put them to bed with a bottle, and then it opens up a whole can of worms. So.
Yeah. So Scotch is okay, right? I mean, because
a good single malt Scotch is fine.
It puts the kid to sleep. I mean, they do that in Alpha.
Absolutely, yeah.
And they overdo it. They do wine and they give the kid that's the best babysitter, right. And sometimes they would do it, and you do have a handicapped child there. So obviously that was a joke. I'm sure everybody knows that.
Of course.
But in any case, so. As a child comes to a dentist with 2 to 3 years, I mean, usually there's really no work to do there, is there?
Right. Generally, there is not. But sometimes we see children, even that young, with dental caries or other problems.
Okay. And it probably gets the child used to see the doctor, and yet he didn't have to pull out that ugly thrill. So it's just
correct.
Like get used to it and realize that this is a pleasant experience. Some dentists they should bring the child to the dentist, just when they themselves go and be there and fly around in the dental chair a little bit and stuff like that.
I advise all my patients to do that with young children, yeah. So they get to see what the office is like, they meet the staff, and it's not a scary experience for them.
Now, what about brushing? I mean, a young child can't really hold that brush. Should he brush? Should the mom do it? Should she do it with a brush, with something else? Shed some light on it.
Well, what we usually tell moms to do with the very, very young children is that those teeth, before the child goes to bed or after they've eaten, can be wiped off with just a damp washcloth that can be used. Also, if you want to get some gauze, you can moisten the gauze and then wipe the teeth off with that. So we usually try to do that when the child is very young. As they get older, sometimes they see their older siblings or their mom and dad using a toothbrush, and there's a wide variety of children's toothbrushes on the market that they could use. But only after they're about 2 years old.
Okay. All right. Anything the mom should be worrying, concerned, or anything she can do if and when the baby starts teething and, obviously in most cases has pain and cries a little bit.
Right.
Should you just go over it, just kind of ignore it? What should you do?
Well, this is an age-old problem, and we've all experienced it, those of us that have children, and we dentists are no different. You're going to generally see with a child that is teething a slightly elevated temperature, and there may be diarrhea or some gastrointestinal upset. So a lot of times when we think the child may have a virus or something, it's really not. It's that they're teething. There's not a heck of a lot you can do for teething. There are a lot of these devices devices on the market. There are teething rings that you can put in the refrigerator that get cold. The child can sort of chew on that, and it sort of helps ease the pain. If the pain appears to be really severe, children's Tylenol can sometimes be used, but I would always consult with the child's physician to see if that's advisable to use that.
Okay. All right. Well, I think that should give some information to the moms and how to handle the teething process. Doesn't seem to be too complicated. It just seems to be normal growing pain, common sense.
Absolutely. Right.
Go through it. Get the child used to the dentist as a friend rather than the first time, right away have a lots of work to do, kind of.
Exactly.
Well, wonderful. Thanks a lot, Dr. Pakman.
You're welcome. Take care.